The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everybody. This is Jenna Davis with Minnesota Milk, welcoming you to our webinar today over the lunch hour. First of all, to all of our attendees on the line, thank you so much for setting aside a small portion of your day to join us for this webinar, How Safe is Your Dairy Farm? Safety is a very vital topic to many of us. At the end of the day, we want to make sure that all of our employees and our family members come home safe. And I think today we're going to learn a lot of information from our speakers, who are Jeff Bender, who is the co-director of UMASH, which is the Upper Midwest Agricultural Safety and Health Center. UMASH is a multidisciplinary collaboration of 5 leading research and healthcare institutions, and their main focus is really to address existing and emerging occupational health and safety issues in agriculture. Also speaking today on our webinar is Amy Liebman, who is the Director of Environmental and Occupational Health of the Migrant Clinicians Network. So welcome, Jeff and Amy. We are so happy you are here. And for our attendees who are out there on the line, just a little bit of housekeeping. Please use the chat box to ask your questions. As this webinar is going on, your lines will be muted so we don't get a lot of feedback. And at the end, we will, at the end of the presentation, we will call out any of those questions and direct them to Jeff and Amy. Additionally, at the conclusion of this webinar, we will take questions, and to ask a question kind of live, there's a little box where there's a raise your hand symbol. All you need to do is click that, and we will be able to unmute your line individually to ask your question. So without any further ado, I think we'll get started now, and I'll turn it over to Jeff. So welcome.
Well, good afternoon. It's a real pleasure to work with Minnesota Milk in providing this webinar. And I know that you are all very busy, and hopefully we can be very succinct and hopefully helpful to you. Next slide. As Jenna pointed out, we are a collective of folks across the University of Minnesota, both in the School of Public Health and the College of Veterinary Medicine, but we also have colleagues at the National Farm Medicine Center in Marshall, Wisconsin, at the Migrant Clinicians Network, and Amy will be speaking today, and also the Minnesota Department of Health. And our funding actually comes from the National Institute for Occupational Safety and Health. Next slide. So what do we do? Really, specifically what we do is try and reduce the burden of work-related diseases and injuries, especially among agricultural workers and their families. And we do that through research, through prevention, through education, and communication. Next slide. So today, we thought we'd present a very brief overview of a couple things, and hopefully that for you to learn. So one is who we are and resources that hopefully we have to support you and your workers, to be aware of some common hazards for agricultural workers, to discuss the importance of animal handling training, and also describe our program to support immigrant workers. And so to start off with, next slide, we've got a couple of questions for you. So Jenna, I'll turn it over to you as to how the polling will be done.
All right, so Brittany will open the poll. So if you are at your computer, shortly there should be a little poll box that starts. So just take a peek at the question and select your answer. And Jeff, the poll is up, so if we want to close it, we can continue to move on, or if you want to add some comments here, feel free to do so.
Yep. Basically, I wanted just to provide just a couple of quick questions to make us think a little bit about some of the safety issues that you might have to deal with. So especially as we're approaching harvest time, thinking about tractor issues. And so this is the first question. Why don't we close this question and we'll go to the next question. So the question reads, to get a cow to move into the milking parlor, do we use the flying zone, the flight zone, the pressure zone, the support zone, or the electric probe? And Jen, I'm not sure if the answers to this will be at the end of our talk, or are we going to put them up in between here?
I don't think we can actually show the results, but we can talk about those at the end.
Okay, sounds good. All right. Why don't we go ahead and close that and move on to the next slide. I want to provide kind of a big picture overview about injuries in agriculture. Remember that agriculture workers are 8 times more likely, unfortunately, to die on the job than any other worker. We have a 40% higher rate of non-fatal injuries, and then animal agriculture workers have higher rates of injury than other ag workers, 6.7 to 5.5 injuries per 100 workers. And the cost of these agriculture injuries are really enormous, estimated at $7.6 billion in medical and a lost productivity cost. So clearly this is an example of the significance of this particular issue. And I don't know if you can see the little piece of paper there that talks about a dairy auction. This is an unfortunate example in our area of where basically a family has had to sell their farm as a result of a farm accident. So to bring it home to local issues, here are some examples of recent issues. Next slide. So this iceberg is really a reminder that what we hear about is really the tip of the iceberg of the injuries and safety issues that occur on a farm. Next slide. The thing, just to kind of highlight one of the iceberg effects here, is to look at workers' compensation claims in Minnesota alone. And just some key summary information just for Minnesota specific is that between 2003 and 2011, there are 505 indemnity claims. So these are people that are out of work for greater than usually 3 days that filed for workers' compensation, and these were dairy workers, with an estimated cost of about $8.5 million were paid. Again, this is the very tip of the iceberg. There are a lot of injuries and illnesses that are not going to be recorded in the workers' compensation indemnity claim that we have. So next slide. So in looking at those claims, one of the things that we did is try to figure out, what were the source of injuries for these dairy workers. And one of the things that clearly comes up and really represents a third of them, represented by the light blue, is basically interactions with cattle. And so that's an important part of what we need to think about when we think about training. Next slide. So in a survey that we did of dairy producers, one of the things that we learned about is that most dairy producers learned their cattle handling skills from their family members. And some could argue if that's the correct way or maybe it was the incorrect way. Also, producers thought that the skill of the human handler was one of the most important factors for really establishing good cattle flow. And they also recognized that time limitations and language barriers were really considered serious challenges for worker training. So next slide. So really what this emphasizes is that interaction with cattle, really is a major source of injuries, as what we do daily in our dairy operations. And that prevention efforts need to really focus on proper training, especially in animal handling. And that brings me to my next slide. So one of the things that we've developed is some training materials on low-stress cattle handling, which is getting the cows to do what we want them to do with as little stress on the cattle as well as on people. And why do we do this? Well, it's a basic animal welfare issue. So, animal handling is important to our daily activities. Also for our employees, making sure that they feel comfortable in working around these animals, and also for their own safety. And then lastly, from a standpoint of productivity, one of the things that we showed is that dairies that actually instituted low-stress cattle handling techniques often had higher rates of milk production than those facilities that did not. Next example, or next slide. So one of the things that we've developed is a series of stockmanship videos. And you can see here that we've got 5 using predictable animal behavior to increase milk production. Secondly, how a cow uses her senses. Thirdly, working with the pressure zone. 4th, moving cows more efficiently. 5, making the milking parlor a happy place. These videos are short. They're usually not more than a couple minutes long, and they're both in English and Spanish as a way to help train workers. Next slide. So here's an example of one of the pictures within one of the videos. So we try to have some active learning activities within there to really emphasize a couple of key points, such as understanding what the pressure zone and the flight zone is, understanding where the blind spot is, and also just emphasizing a little bit of cattle behavior, recognizing that they have limited, sometimes, depth perception. Next slide. We also try to provide some really simple ways to really help workers understand, some key points of working around cattle. One is that they need to be patient. They need to think about the angle of their approach. They need to think about their location in relation to the cow, and also recognize that cows actually move slower than people, and so we need to actually slow our speed down a little bit when we're working with cattle. So this was just a quick overview of a little bit of some of our programs, our training programs, and also some of the ways that we're trying to work and educate with producers. Now I'll turn it over to my colleague, Amy, and she can talk a little bit more about one of our specific programs on immigrant health.
Great, thanks Jeff, and thanks everyone for having us here. Jeff and I are working on a project together that I worked on 5 years ago in Wisconsin. We did a 5-year program, and now we're working together to bring this project called Promoting Worker Health to Minnesota. And essentially, it's about training workers and then working with a select group of workers on each farm so that they can serve as safety promoters or community health workers. There's lots of different names for them, but essentially they reinforce some of the messages that we put forth in the training. In our project, we're making some changes that from our Wisconsin one, and that we're trying to further engage some of the veterinarians to help with doing an evaluation of cattle handling skills and helping workers to carry out those skills. And lastly, we're working with some healthcare providers to respond to requests from producers about how can we broaden our safety conversation to also include some basic health care for workers, so that some basic health needs can be addressed in addition to looking at the safety needs. The next slide, please. So our ask for those of you who are with us today is that we are actually looking for some farms in Minnesota, and we're looking for dairies that have 6 or more Latino workers to provide the safety training to. And then we're also looking for some veterinarians to help us assess how well the workers are doing. So we're going to be doing a number of things, and we've already started with some farms. We're very excited that Minnesota producers have welcomed us with open arms, and we welcome those who are interested in our program to partner with you. Next slide, please. So we've talked a little bit, we've touched on this idea of immigrant dairy workers, but the reason that we started this program several years ago is that we recognize that there are changing demographics on our dairy farms in the upper Midwest and across the nation. We recognize that immigrant labor now accounts for 51%, more than half of all dairy labor. Next bullet, please. and that dairies that are employing immigrant labor are producing 79% of the U.S. milk supply. So some of our bigger dairies are using immigrant workers, and we recognize from requests from producers that there were lots of training needs, cultural language issues, and we wanted to try and help that from a worker health and safety perspective. Next slide, please. So I want to just walk you through really quickly about some of the worker demographics, or a little bit of the background of the workers in our Wisconsin project. And of course, we don't know for sure, but we can generalize some of these background pieces about immigrant workers and help you understand what our thinking was and the types of materials that we developed. Next slide, please. So in essence, in our Wisconsin program, we worked with about 67 farms. We trained 836 immigrant dairy workers, and not surprisingly, the majority of them were male, and they were by and large younger. 32.2 years old was their average age. Next slide, please. They were largely from Mexico. About 89% were from Mexico. They had been in the U.S. about 8 years and on average, and then they had about 5 years average dairy experience. Now that all ranges, these are just our average, but it's helpful when we're thinking about the kinds of materials that we're going to develop. Next slide, please. Not surprisingly, 96% of the workers that we trained did not speak English or did not speak English well. And this next one was really important to us. The average years of formal education of the workforce was 8 years. So they had an 8th grade education. And that's not all that surprising to us because they're from Mexico, and 8th grade is about the year that Mexico ends free public education. And so a lot of our workers were literate. Some had obviously an 8th grade education, but others could not read and write at all. So we really had to think about that level of formal education as we were producing our materials. Next slide, please. And 70% had no health and safety training. So by and large, we had a population that was from a different country, different culture, spoke a different language, had relatively little dairy experience, particularly in comparison to sort of the producers and their families, and certainly had very little safety training. Next slide, please. So what we did is we thought about sort of the types of educational programs that work well with this population of folks that were hardworking, had a lot of sort of on-the-job experience, not a lot of formal education. And what we did is we looked at a model called Educación Popular, or non-formal adult education, which really considers the formal training education level, the literacy level, the culture, and thinks about different ways to relate these messages to the workers or to the community. And pictured here is a program that I worked on in the 1990s, where we basically were using this community health worker model, training a layperson who didn't have a lot of formal education herself in some key points about community health, and she then was reinforcing those messages and training her neighbors. Next slide, please. So what we asked ourselves is, could we use this community health worker model that was applicable to different populations without a lot of education from developing countries, and would it be applicable to dairy? And could we incorporate some of those popular education methods in order to improve worker health and safety? Next slide, please. So the first thing that we did, we wanted to fill a gap, and that was to develop a bilingual curriculum for dairy workers. And we wanted it to be used by farmers and loved by farmers and producers and loved by workers. We wanted it to be relevant. So we made sure that the Occupational Safety Health Administration approved all the content, but we also got a lot of input from producers, from workers, from occupational safety and health experts. And we came up with a little bit of a compromise. We came up with 5 modules, 1 hour each, on different topics, and I'll go over those topics in a minute, and created a background section and a step-by-step facilitator's guide, and then a visual presentation for the learner. And each of our modules were reinforced with different kinds of resources, bilingual comic books, and other resources. Next slide. The topics included a general introduction to hazards and how one engages with hazards. In other words, what are the steps that a worker can do to protect him or herself, and what are some steps that farmers can do to make the farm safe. Next week, we delved into a full session on animal handling, and in our program, which is really fun about our program right now in Minnesota, is that we're really incorporating some of the work that Jeff has done with his animal handling into our work. The other modules are machinery and equipment, worker rights and responsibilities, and then chemical safety and confined spaces. Next slide, please. We use a lot of pictures recognizing the literacy level. Here's one about talking about making sure, essentially motivating people ultimately to wash their hands, but using images to show how one might get sick from manure getting into one's body, using simple messages and simple images. Next slide, please. And they're available, and I'll walk through it at the end here. They're available either in flip chart form or in PowerPoint form. And the farms that we partner with, of course, we give them a flip chart of the 5 modules so that they can keep using them for training, and also our PowerPoints. And those who aren't participating with us, maybe you just want to look at the materials, I'll walk you through. They're all available to order from our website. Next slide, please. These are just an example of some of the resources that we use after the training to reinforce our safety messages. These are all available to download as well. The one that's in front, the Safety in Words, Producers of Love, it's a bilingual Pictionary with words in English and words in Spanish that really has helped a lot of producers communicate with their workers. Next slide, please. And this is just to show you that at the end of our project in Wisconsin, and we know we're going to have similar results in Minnesota, that our worker knowledge really increased significantly. We were really pleased with the results, and also the National Safety Council awarded our project for the kind of collaboration and work that we're doing, but we're pretty excited to show this kind of increase in knowledge. Next slide, please. So really quickly, what do the community health workers do? So what we did is we trained workers on the farm, and then we selected 2 promotores de seguridad, or safety promoters, or community health workers, to help do a number of things. If you could click on that one more time. So the community health worker on the farms, what they do is they would do monthly observations. Are there new hazards? Is something broken? And they would then talk to the producer or their manager about what needed fixing. They would reinforce safety practices. They would train new workers, and then they would also participate in monitoring calls and visits, because we wanted to make sure the community health workers had support. I could give you a whole other presentation about all the results, but by and large, our program, whether we use the community health worker on the farms with our workers or whether we simply did the training, we're very successful, and the producers in Wisconsin, by and large, wanted to continue the program, and we're quite pleased with this concept of having a worker help to promote the safety on their farm after the trainings. Next slide, please. Just really quickly, I'm going to walk you through. There's 2 websites that are helpful for getting resources. All of the safety training curriculum that I just went through is available at this website, migrantclinician.org/seguridad, and you can look at PDFs of all the lessons and then click on that yellow bar to request the actual electronic file. So you can view the PDFs, you can download the PDFs very easily, but if you want the actual PowerPoint and the flip chart files, you can go ahead and order the electronic versions from us. And we do that because the files are so large, we have to set up a separate way to give them to you. A, and B, we like to follow up with the folks that are using our work so that we can see how they're being used and what recommendations they have for improvement. Next slide, please. This is just showing, again, on this website, you can look at the PDFs, you can get the other resources, they're available for download. Again, and then if you want the files to actually do the training, just simply fill out the little form on the yellow bar. Next slide, please. And then Jeff mentioned that we have a number of resources from UMass available. I encourage everyone to look at the UMass website. They're all there. We have a lot of English and Spanish materials in addition to the curriculum, the videos that Jeff mentioned. Next slide, please. We also have a farm safety check sheet. Again, there's just different resources, and you may find them useful for other areas of farm health and safety improvements. But we hope that you take a moment and check out some of these resources and that they're useful to you. Next slide, please. Again, you can connect with us in a number of ways. I think our website is probably the easiest, but feel free to engage with us in any way that you can. And I think our next slide is we'll open it up for some questions.
All right, if anybody has some questions, again, on the phone lines, if you have a question, please feel free to raise your hand and we will unmute your line. But just as I sit here and kind of digest some of this information and all of these resources that you provided, Jeff and Amy, first of all, thank you so much. But one quick question I have in regards to the One Health project that Jeff mentioned, where should we direct interested farmers to? Should we contact you directly? Who do we tell?
Jenna, thanks for asking that question. Yeah, I mean, one of the things that we're currently doing is enrolling dairies in our project, and we're looking for dairies that probably have anywhere from 3 to 6 Hispanic workers who you think might benefit from the training. And you're welcome to contact us, and we'll try to triage. We don't have a lot of money, but we have some to enroll some farms in, and we're trying to stagger them in because our staff is limited and that we can't visit all farms all at the same time. But please feel free to contact us, and we'll try to work with you.
Absolutely. And just a quick follow-up to Jeff, about how many farms are you looking for total for this?
For our multi-year project, we're hoping to enroll 30, and we hope that there's a multiplier effect here a little bit. But yeah, so ideally, we hope to enroll this year about 5, and the following subsequent years about 5 to 10.
I'm putting into the chat box, and I'm hoping that everyone can see it. I guess I don't know if I can send it to everyone. I don't know what's available, but I'm sticking in an email address that might be helpful to let folks know about. But it's very easy to go onto the website and connect directly to us, or if you wanted to connect with Jenna, that's fine too, and we'll follow up with you. But I put on our coordinator's email address, which is vasquezc@umn.edu, VAZQUEZC. And I don't know if you can copy that and make it visible to everybody.
Jenna, the other thing that we've been working very closely with is with Extension. So feel free to contact your Extension agent too if that is a point of contact for you. And so, yeah, so we've been trying to reach out and engage our Extension faculty to be part of this team as well.
Excellent. And I've played around a little bit on the website and looked at some of the training modules. I opened up those PDFs, and I think they're an absolutely fantastic tool to have in the Dairy Farmers Toolbox. So thank you so much, first of all, for putting that program together. I think that is fantastic. And there is the coordinator's email address. Thanks, Brittany, for putting that up for everyone to see. But where I was going with this, now I had a loss of my train of thought, you guys. I apologize. But with the training modules, what is your best recommendation for how often farmers, managers, employees should sit down and have a conversation about safety?
Well, Jeff, I can share some of our experiences from our Wisconsin project, and feel free to jump in. But we really encourage, obviously, once folks were trained and having this person on the farm helping to sort of think about safety issues and reinforce safety issues, we found it worked really well with at a minimum a monthly meeting where they talked about it, and it doesn't have to be long. Or sometimes, like right at payday, it worked well to have just a little chat about, maybe some safety issues that were happening, or something that was a learning experience. So at a minimum, I would say a month, and then but sometimes people felt, a little weekly chat. But it depends on sort of what model of safety you have on your farm. So if you have someone who's thinking about safety and reinforcing it, maybe you don't need as many meetings. So Jeff, I don't know if you have any thoughts to add to that.
Well, I'll probably be a little bit more controversial. I'm going to say every day we should probably be thinking about safety. And so I have this idea of trying to create a culture of safety. And so one of the dairies that I've had a chance to work with, they actually have their morning meetings, and basically the reminder is remember to be safe today, and they talk about that. So I think Amy's right. I think it's important to have periodic meetings, but at the same time too, probably one of the chief things that often we forget about, especially me sometimes, is that we need to be thinking about how do we be safe today. And so it's really creating that culture of safety.
Hopefully that's not just controversial for this crew on the phone here.
No, I think that it is something, like you said, Jeff, it's creating that culture of safety. I think that's important. And I know from my perspective, both in my professional life and my personal life, I want to make sure that all farmers, the farmers, families, employees, everyone gets home safe at night. I think that is something that I am really passionate about, and want to make sure that we extend that message the best we can. And Brittany says that we have the poll results ready, so we're going to go back to those to see how what our responses were to the questions at the beginning. Bear with us a moment as we go back to the poll question slides, and we anxiously await the results.
Okay, so for the first question, at what rate does an arm get wrapped around a PTO? 78% said 7 feet per second. 11% said 1 foot per second, and 11% said not sure.
So, Amy, the correct answer is?
B. 7 feet per second.
All right, and then to the next question. To get a cow to move in the milking parlor, use B. 0% said A, 38% said B, 63% said C, 0% said D, and 0% said E.
Yes, we were looking for C on that one, the pressure zone.
It sounds like we had a lot of smart attendees, so thank you everyone for participating in those fun polls. And even if you answered incorrectly, I hope it wasn't a learning opportunity for you to understand just a little bit more about safety. And with that, I will ask one more time, are there any final questions out there on any of the phone lines or on the computers? This is your last chance. And hearing nothing else, Jeff or Amy, any last words before we depart?
Nothing for me. Thanks for the opportunity, though.
Nothing from me. Stay safe, and thank you so much for giving us this opportunity, and we hope to engage with you with our various programs.
Absolutely. And thank you on behalf of Minnesota Milk, Jeff and Amy, for presenting. We really appreciate your time, and all of the links and resources that were highlighted today, we will share those with attendees. So please be on the lookout for those links and resources. But thank you, everyone. Have a great rest of your day and have a wonderful week. Thank you.
Thanks.